Hello, my name is Joan Sandra. I am an osteopath and yoga teacher. First of all, I want to let you know that in October, both in Barcelona and Valencia, I am giving a workshop on organs and emotions, including both theory and practice. We do yoga poses, specific sequences for each emotion, and in addition with live music. That said, today we're going to talk about lateral bending postures. Let's go to the screen. Our joints allow us to make other types of movements besides forward and backward, which are lateral bends. These are the most limited joint movements and the least automated in our neural maps, since performing a lateral bend requires more complex commands from the brain. When we do side bends, for example, an Utthita Trikonasana to the left side, it's the right side of the brain that will be working, the one that will coordinate better. Therefore, extension and flexion postures are not the same. Here, issues of laterality come into play. That's why lateral bending postures are important, as they have a more significant, deeper effect on the brain than forward or backward postures. When we perform side bends, we must always first consider elongating the spine so as not to excessively compress the intervertebral discs. What is happening at the musculoskeletal and joint level? Lateral bending postures are fantastic for correcting lateral deviations. For example, if we have scoliosis, a joint deviation to the right side, that is, the lumbar area shifts to the right while the thoracic spine remains straight, this type of lateral movement, such as Utthita Trikonasana, in this case to the right side, meaning toward the direction of the scoliosis, allows for joint correction since we push the vertebrae toward the opposite side. That is why lateral bending postures will always be beneficial for lateral corrections, for lateral deviations of the spine. Obviously, if we have a right lumbar scoliosis, we need to do both sides, but we start with the right side and hold it for twice as long. Why hold it twice as long as the left side? Because the neural maps of postures, when a person has a right lumbar scoliosis, the neural maps for posture are already established. So, if we do both sides, we gain flexibility, but we are still deviated, because the neural map remains the same. That's why when we do a tilt to only one side, we focus specifically on that movement, we emphasize the positional memory in the brain. That's why it's important to hold it for twice as long on the corrective or positive side. What happens at the muscular level? For example, if we tilt to the right, the muscles on the left side, the left muscle chain, get stretched. Here, it's a bit like what we discussed regarding the joint. If I have a muscular shortening, for example, of the left quadratus lumborum or the left obliques, I tilt to the right to stretch those muscles. Should I do both sides the same? No, I will hold it for twice as long on the corrective side. Which side is the corrective side? Normally, if there is no specific pathology, the side that is harder for you is the correct side, the more corrective side. In this case, if my left quadratus lumborum, oblique, or serratus is shorter, I will hold it for twice as long because it will be harder for me. That makes sense because the left side is shorter. So lateral bends allow us to stretch the entire muscle chain. In this case, if we do a right side bend, we stretch the entire left muscle chain. Here we have the same thing, an Utthita Trikonasana to the right side. The red areas are what gets stretched and the blue areas are what contracts. It's not a perfect software, but it gives us a general idea of what is being stretched. Here we can see the stretch of the left lateral chain when we do a right side bend. It's important to keep in mind that the right lung is 1/3 larger than the left lung. If I'm going to focus on the respiratory system, it makes sense that to have a greater initial breath and a better respiratory sensation, I would do a left side bend. In this case, a left Utthita Trikonasana to expand the right lung. Then we'll do the opposite side, of course, but to start, if we want to expand the right lung's rib cage, we begin to the left side. Remember that it is 1/3 larger. And it's not just about the lungs themselves, but also the muscles involved, both secondary and primary respiratory muscles. The intercostals, we have the diaphragm, the main respiratory muscle. So it's not only that lateral bends affect the lungs themselves, but also the muscles involved in breathing. What other effects do we have when we do lateral bends? For example, the organs. Simply put, if we carefully examine this particular image, and I wish to perform some detailed work on the internal organs, it is widely recognized that the most vitally important organ within the entire human body is undoubtedly the liver. And we can see that it is in the central part of the body, and especially on the right side, which is larger. So logically, for the organs and glands to function better from a yoga perspective, we will apply compression and decompression to that organ. It's like if I have a sponge inside a bucket of water and I want to clean it, first I compress it and then I decompress it. Exactly the same. If I want to work first, the liver, I will perform a right lateral bend, a right Utthita Trikonasana, to gently compress the liver so that any accumulated toxins are effectively released, then expelled into the bloodstream and subsequently toward the duodenum. Then, I perform a gentle left bend to effectively expand the liver, thereby allowing fresh oxygenated blood to thoroughly enter the liver and significantly help cleanse it, ultimately improving its overall organic function. In yoga, when we work on the organs, the treatment, or rather the improvement of the organs, is slow and gentle, because even if there is compression, here we have the intercostal muscles, we have the ribs, it will always be gentle. If I focus my attention, let's set aside the liver and the gallbladder, since one is entirely dependent on the other, and carefully leave the stomach on the left side of the body. So when we do lateral poses, we have to first think about where we want to work. In this case, if I'm going to work on the stomach, which involves first a compression and then a decompression, I would do an Utthita Trikonasana, or any left lateral bend to compress the stomach. Then I would do it to the right side to decompress it. We have intestines, which in this case it almost doesn't matter whether it's one side or the other. But when we work on the colon, here it really does matter. If we look at the ascending colon, it's on the right side, then we have the transverse colon, and then the descending colon. If I want to improve intestinal transit, which is driven by peristaltic waves, here we have the diaphragm, and I'm targeting the vagus nerve. When I do lateral bending postures, I also have to understand that I'm unlocking the diaphragm, and by unlocking the diaphragm, I relieve pressure on the vagus nerve, which is responsible for transmitting electrical and peristaltic signals throughout the entire digestive system. Let's go back. If I want to, for example, if I have a significant and complete blocked intestinal transit in the colon, the most logical and probable thing is that the blockage is located right here, because we can clearly see that this particular curve, which is commonly called a flexure, is much more closed and constricted. Normally, we would typically start by carefully opening this particular flexure, gently opening the angle of that large intestine. How do we do it? We do a left lateral bend so that it lifts up. The ascending colon, the transverse would go like this, and we decrease the angle of the flexure, allowing the chyme with the digestive residues to pass through the flexure and go to the descending colon and then out. What other organ do we have? The pancreas? If we look, its position is between the center and the left side. The tail would be on the left side. Well, the same thing. If I want to work on the pancreas, if I want to activate it, make it function better, and expel toxins, I will first do a left bend to compress mainly the tail of the pancreas, and then I will do a right bend to decompress it. What other organs do we have? The kidneys. If we look at the position of the kidneys, the left one is higher than the right one. If I want to work on the right kidney, I will have to do a deeper, more intense bend, because the kidney is lower, and if I bend to the left, the kidney is higher up. Therefore, we can already see that we have to prioritize which organ we need to work on. So we will do one side or the other depending on our intention, depending on what we want to work on. Which glands are we mainly going to work on? Since we were talking about the kidneys, we have the adrenal glands. The adrenal glands are here, so it's the same. If I want to work on the adrenal glands, right bends compress the right adrenal gland. And if I bend to the left, I compress the left adrenal gland. The same goes for the pancreas. We've said that it's an organ, but it's also a gland, so it's the same thing. I'll do a left bend to compress and a right bend to decompress. In this case, the gonads, if they need to be worked on, for example, the ovaries, when I do a right bend, a right Utthita Trikonasana, it won't affect the right ovary as much. We would need to look for another type of posture. In this case, we would do a Parivarta Janu Sirsasana. To compress the right ovary, we do a right side bend and rotation, and for the left ovary, to the left side. When we bend to the right side, for example, if we do a right bend, in this case, a Utthita Parsva Konasana to the right, we raise the left arm and we are opening the aorta artery, which comes out of the heart on the left side. In this way, we improve the flow of blood through the aortic arch, which is that passage of the artery. In this way, we improve the flexibility of the arteries, especially the arteries. Veins are more flexible, so they won't be as affected. But if, for example, I tilt to the left side, what I will open is the hole that compresses where the superior vena cava passes. In this way, we ensure that the vein is not pinched when we lean to the left. the lymphatic system is activated by the compression of the muscular system. The lymphatic system does not have a specific pump like the heart that moves the blood. So, muscle contractions allow the compression of the lymphatic veins, and this causes the lymph to ascend toward the jugular. In this case, when we lean to the right side, we are compressing the quadriceps, which are the muscles that will compress the lymphatic vessels in the right leg, and we are compressing the right side of the body, which allows for that right side lymphatic compression. We would do the same on the left side. In this case, lateral bends activate one organ or another, and each organ is linked to specific emotions. That's why, if we do a right lateral bend, we are compressing the liver, which is associated with anger, rage, and fury. If we do a left lateral bend, we compress the pancreas, we compress the intestine, affecting frustration, for example. When we do a left lateral bend, we are activating the right brain, which is more emotional, and when we do a right lateral bend, we are activating the left hemisphere, which is more rational. Therefore, with lateral postures, we can also work on the emotional aspect involved, not just the organs, but also the brain hemispheres. On an energetic level, when we do a right lateral bend, we are supporting all the weight, in this case on the right leg, and we are working on the Pingala channel. It is an energetic channel, masculine, fire, sympathetic nervous system. On the other hand, when I do a left lateral bend, I am working on the Ida channel, which is feminine, lunar, and parasympathetic. Well, I hope you enjoyed it. See you next time.